Hello friends, Namaste. This is Dr. Meenu Sharma from California. Again coming back with some queries, some answers to the people who are dealing with COVID, the second wave in India. There are a lot of queries, lot of questions inside the brain of the people who are dealing with this pandemic, and this is the anxiety which is going through while watching all this news. Number one thing, if you are exposed, like if you were traveling with somebody who was just tested positive and then you just run to the lab the next day or the same day to get tested for that COVID-19 rapid test or whichever test is available in your lab at that time, please, you do not have to get tested on the same day when you find out that you are exposed. You have to wait for 4 to 5 days, or if you become symptomatic, then only you need to get tested. Otherwise, you can, yes, use all the precautions, wear a mask, stay inside the house, don't expose other people, but you do not need any test. And for the people who are testing positive, but they have just the symptoms of fever or body ache, they do not need the CT scan or the X-ray chest. We are seeing a lot of people are getting all those tests, including tons of blood tests, which do not need it. You do not have to take. Listen, COVID-19 is a virus which belongs to the SARS virus category. We still do not have any medication which can kill this virus. We do not have any treatment for this virus. We are just treating it symptomatically. And when people are rushing to the hospitals also, what treatment are they getting in the hospital? That is a symptomatic treatment. If person has a high fever, we are treating them with the antipyretics, which is paracetamol, calpo, or crocin. If they are dehydrated, we are giving them the IV fluids. Yes, if their oxygen is falling below 90, we are providing them the oxygen supplementation. Oxygen is in everywhere. It's in the environment. It's God given. But when your body is not sustaining that much of oxygen, then we are giving them the this supplemental oxygen. The other fear and the wrong information people have, they start taking the medications, because these days all these messages are going all over by the messenger or WhatsApp or Telegram or even on the Facebook also. People are just posting the prescription which they got from their doctor, which somebody has made, but those are the medications are for the people who really are symptomatic. Believe me, if your oxygen is staying above 92, you do not need those medications. And if you have fever, you just treat your fever. Yes, eat healthy, well hydration, which is very much required. You have to drink 2 to 3 liters of the water in either form, either water or scangvi, lemonade, juice, green tea, hot water, even coconut water. So you have to keep yourself well hydrated, but you do not need those injection of remdesivir. We have seen that they are kind of running out of the stock because lot of people have stocked it. You do not need. Even lot of antibiotics people are have started taking it. Please do not take any antibiotics without the prescription and without contacting your doctor also. And if you do not have any bacterial infection, those bacterial antibiotics are not going to help. And if your oxygen drops below 90 but still above 85, you can still manage yourself at home. You do not have to rush to the hospital. At that time, you can start taking a steroid, which is known as prednisone or dexamethasone. Those are the steroids which you can start taking, but yes, you need a prescription from your doctor. But you do not have to repeat your test or your blood test. You do not need a still X-ray chest or a CT scan. Next, coming in the next video.